I was given the opportunity to have the first 3D machine in Oregon, but I declined because I didn't think the images were good enough. But when Fujifilm came out with the Cristalle, it just blew us away. It has so many benefits compared to the competitors. Better images, faster, and it's more comfortable.
Often, the biggest pushback I get for people deciding that they want a mammogram is fear, pain, and the dreaded callback. In addition to making sure that she's got equipment that she trusts, she also will look at the images in real time and give patients the answer in real time. She feels that women deserve to have that immediacy.
Because that's what I would want. But the main thing is it requires a reliable equipment where you can trust the images, so once you see them, you're confident the woman is normal or not normal, and that's what the Fujifilm ASPIRE Cristalle offers us. It's more efficient to get things taken care of while the patient's there. It's so much better for the woman, too. Having reliable images takes away a lot of the guesswork and reduces the stress. In 2019, I got my screening mammogram, and lo and behold, visible only on the 3D images, was a 7-millimeter breast cancer in me. I thought, I'm really glad we bought this machine. The technologists love the equipment and tell me that it's overwhelming. The patients love the comfort paddle, and they comment that it's much more comfortable.
When I've sent patients who are reluctant to get a mammogram to Dr. Thurmond, the feedback was that was so much better than I was anticipating.
They tell their friends that it's comfortable, it's not scary, you get the results right away. And so right now we're booked out 3 months from now, and that's with no advertising whatsoever.
There just didn't seem to be that extra time for me to get something scheduled. And so for 10 years I didn't. During the pandemic, I had a little time to think about maybe I should start going. So I did, and I came back, and it was nothing. I had a conversation with Dr. Amy Thurmond, and I said, well, how often do I need to come? And she goes, well, how long do you want to live? So, well, I swore to my granddaughters I'd live to be 100. And she said, then you better come back every year. So I came back last year. And this time, that wonderful machine found something so small, she could barely see it on the screen.
What we were able to do is find a very subtle change, which was precancerous.
Without the machine, without a competent radiologist, I wouldn't be afforded this opportunity. But I have both, and I'm taking advantage of it. As long as I have control of my life, I feel healthier, happier, and more able to face the future.
I'm a big believer in preventative medicine. Currently, mammogram is the gold standard for breast imaging. And I think with the 3-dimensional technology, we're getting better reads and we're picking up things early. And that's the purpose. The purpose of having screening mammogram is to diagnose early breast cancer. Early detection is key in prevention and in treatment.
Our practice has to be efficient. We're small, we take time with patients. We cannot afford to have the machine go down ever. It's not just economic, it's also for the patients. They depend on us to be here. And the equipment has been reliable, images are easy to read. It just makes all the difference in the world.